Okay, good evening and also good morning if those are not. Okay, hi everyone. So I'm Polly. I'm from the School of Public Health. Welcome. I see some of our current students as well as our alumni. So welcome to this session tonight. We're very, very lucky to have Allison and also Chantal, both from the National Board of Public Health Examiners, to do a delivery information session for you about the getting certified in CPH. So it's something called a certification in public health examination. So as you all know, if our HKU NPH degree has gotten the accreditation from the Council of Education on Public Health, and one of the benefits of graduating from a self-accredited master degree is that you're eligible to write for the CPH examination. So this is why the purpose that we have invited both Allison and Chantal and to brief you and to let you know more about the certification. So Allison, hi, I will pass everything to you. I'll be here if you need anything. Thank you very much.
Okay, well, thank you, Polly. Good evening. I want to say good morning, but good evening to everybody. I'm just so excited you decided to join us on a Friday evening. I hope you've had a great week, and this will be a good way to end it with hearing more about the certification in public health. So I'm Allison Foster. I'm the president of the National Board of Public Health Examiners, which is the entity that offers the CPH certification. We've been around for a little over 10 years and are just really pleased to be able to talk to you about our certification. I'm going to ask my colleague Chantal to introduce herself, and then I'll get our slide presentation going.
Good evening, everyone. I am Chantal Johnson, and I am the Director of Certifications for NBPHE. Really happy to be here with you to inform you on the CPH certification exam. I've been here with NBPHE now for 4 months. However, I've been managing, overseeing certification programs for almost 20 years now. So again, thank you so much for having us, and looking forward to helping you out through the process of earning your certification.
Great. And I also want to take a moment, just say congratulations on your accreditation. That is a remarkable achievement. We're well aware of what it takes to become CEPH accredited. And we're just very excited for your school and your students and your alumni. So I had to restart my presentation so I could get the sound. I have a video for you. So just give me one moment while I adjust to get the presentation going. Oh, nope, I did it again. Just one more moment. Let me try this again. There we go. Okay, I think I got it. Yeah, I just want to make sure the sound is going to work for you all. So we're going to spend, I think we said we take about 45 minutes, go through everything I think you'd like to know about the certified and public health professional and certifications in general. And we will save some time at the end to answer any questions you might have. Okay. Great. So the National Board of Public Health Examiners, that is the organization that offers the CPH. We're actually in the process of developing other certifications, but currently the Certified in Public Health is the certification program that we do offer. So we are an independent organization. We are based in the United States, though we do test candidates from many different countries. So it's not a US only certification, but we are based in the United States. And we do have a board of directors that oversees our operations and our policy and governance. And these organizations are the organizations that founded the National Board of Public Health Examiners, and they represent academic public health practice, governmental public health. We also have about a half dozen at-large CPH members on our board as well. So we've had a lot of successes and growth in the last 10 years. To date, we've had over 12,000 individuals have sat for the CPH exam. And as you can see, we've had candidates from and in 95 different countries sit for the exam. So again, it is not just for the US, that we do test worldwide. And currently we have 11 schools and programs accredited by CEPH that require the CPH, not your school, don't worry, but 11 schools and programs have made the decision to make that part of their graduation requirement. So let's first start and talk about why certification. So I know that's something that you all might be considering, is that you're completing your degree. So how does certification fit in with your professional pathway, and why should you consider getting certified? So I want to talk just for a moment about certifications and how they do fit into a profession. So this is what you see here is a diagram that shows what often is thought of as the three legs of the professional stool. Is most professions have these three components. The first at the top is accreditation, and certainly public health has accreditation. You've got CEPH accreditation. And there are a number of countries where there's also accreditation of the institutions like health departments. So accreditation is at the institutional level. Then we also have had degrees in public health for over 100 years, and you all are on a degree track, and that's commonly thought of as the terminal point in your preparation for a career in public health. What we have not had worldwide is a common licensure or certification, and this is the verification of the competency of an individual as opposed to an accreditation, which is institutions. Certifications is the assurance of an individual that they are prepared to work in a profession. So there have been some specialty certifications, but as far as we're aware, there have not been many broad public health certifications for individuals. So that is one area that a number of organizations have talked about for years, is that this is the next step, is that public health needs to do what all the other professions have done, is to add a certification to really take that next step in becoming a profession. So in the United States, at least, there were a number of discussions held over the last couple of decades, going back actually earlier than 1980, but there were task forces in the 1980s discussing the need for certification in public health. And so as you can see, there were a number of papers and feasibility studies, and finally in 2005, the decision was made, let's build a certification for public health. So the first exam was given in 2008. And here we are 14 years later, and we've certified over 10,000 individuals in public health. So it's been a long road, but now we are on our mission, and we are certifying public health professionals. So one question that we often get, and I think might be relevant to you all, is, do you need a certification if you have a degree? They measure very different things. So our answer is yes. A degree is evidence that you have completed coursework that is integrated and rather deep in scope, and you've completed a series of courses and practice components, and then you earn your degree, and you keep that degree lifelong. So a certification, on the other hand, is validation that you have the knowledge needed to work in a field. And once you have that certification, you do need to keep that certification active through recertification or continuing education requirements. And it's very, very common that professionals in other professions have both a degree and a certification. They're very complementary, and they measure different things. And the examples that we've got here might resonate with you. You probably can think of others, but there are many, many, many other professions where the individual does have to have a degree, but they also have a certification that they keep valid throughout their career. And so this is the path that we are following with public health degrees and the certification in public health. So there are a lot of reasons why individuals decide they want to get certified. For the most part, it is voluntary. I'll talk about this in a minute. There are some jobs that do require the CPH, but for the most part, it is voluntary. It would be your decision whether you want to get certified in public health. But rather than me talk about these points, I'm actually going to show you a video. We brought some certified in public health individuals into our office a few years ago, and we asked them if they could talk about why they got certified in public health. So I'm going to play this video for you and let you hear from them.
I graduated with my MPH 2 years ago, and I knew that I wanted to be certified in public health. My employer was thrilled to see that I have my CPH because they know that I'm a lifelong learner and I will continue to build my skill set.
I'm from an underserved community. I'm from Mississippi originally. That's why I decided to pursue a master's degree in public health. And I earned that a couple of years ago. And now with the certification in public health, the communities I serve will know that I'm up to date, I'm keeping up with my education, and I'm striving harder, and it will benefit those communities.
After returning from the Peace Corps, it was important to me to continue my public health education. As a community health volunteer in a rural village, I worked closely with decision makers and other community health volunteers. The CPH allows me to enhance my skill set through continuing education credits.
I took the CPH exam and got certified in public health as a self-affirmation of the knowledge and skills that I had received during my Master of Public Health program in Policy and Management. It was a fantastic way to share with my family and friends what I had learned during my 2-year program. It was also a great way for me to share with the general public that I care about my continuing education and want to advance the field of public health.
Even though my coursework provided me with the essential fundamentals of public health goals and initiatives, getting certified will help me excel in my work beyond the classroom to the broader hands-on field of public health, advancing my career as a public health professional.
I see the CPH as an opportunity to recommit myself to the field of public health and to renew my knowledge in all core areas, especially those that I don't get a chance to practice on a regular basis.
Getting certified in public health is a way for me to show my dedication to my profession and to also show that I'm up to date in the profession and I know what is happening and I can do my job.
All right. So I do know that you all had questions about whether employers require the CPH. So our answer is that in some cases, yes, there are some employers who require the CPH. There are many employers that are starting to learn about the CPH and starting to prefer the CPH. We actually partner with ASPPH. They have a job board called Public Health Jobs, and the employers can indicate if they prefer the CPH, and we keep an eye on that just to sort of get a sense of the cadence of how often, what type of jobs, et cetera. The CPH may not be required or preferred in every case. There are going to be some cases where the employer is not aware of the CPH, or and maybe they just chose not to make any specific preference in the job posting. But what we can tell you is that employers do prefer certifications. They value certifications in general. So even if an employer is not specifically aware of the CPH, that does not mean that they would not see the CPH on your resume and realize that's an attribute. That's something positive that you bring with your application. So this graphic that I'm showing here is results of a poll by Gallup, and they surveyed employers and asked them how they felt about certifications. And as you can see, the vast majority of employers thought that certifications were valuable. So as I mentioned before, we gave the first exam in 2008, so we're still fairly new. But as time goes on, we are finding that employers are more and more are hearing about the CPH and are starting to require and prefer the CPH. We're also seeing a trend that it's becoming more preferred in areas where we do have a lot of CPHs. So there are a number of schools and programs that are currently requiring their students to take the exam. So when they graduate, they go out in the local community often, start looking for jobs, and the employers over time have realized these are really great candidates for my jobs. And over time, those employers specifically in that area are starting to require the CPH exam. So it's happening on a local level, and it is growing, in different areas. So as your students at your school become accredited, I would think that your employers would over time start to prefer the CPH exam. Okay, so we're going to start talking about the certification process. It basically is a 3-step process. The first is eligibility. So you would need to apply to get certified and make sure that we would make sure that you are eligible. So if you are currently a student at the University of Hong Kong public health program, you would be eligible to sit for the exam as long as your program says that you've taken enough classes. We just don't want students to rush in and sign up for the exam before they've got really the core knowledge under their belt. So once your program says that you're eligible to take the exam, then you could sit for the exam. And if there's anybody on the webinar today that graduated, as long as you graduated before the effective date of accreditation, then you would also be eligible to sit for the exam as an alumni. So once you are approved, then you will get a message from our testing partner Measure asking you to schedule your exam. You can take as long as you want, or you can schedule your exam right away. And I'll talk to you a little bit about the scheduling process momentarily. When you take the exam, it is a 200-question exam, standardized questions, and there's no grandfathering. So everybody who's certified has to pass the CPH exam. And then finally, you would need to maintain your certification through a recertification process. And I'm going to go through all these in a little more detail in a moment. So I'm going to skip this slide, and I'm just going to talk to you again about eligibility. Again, so if you have graduated on or after the effective date of accreditation, and you're an alumni, that you would be able to sit for the exam. And if you're currently a student, it's really up to your program to determine if you've taken enough classes. So I suggest that you talk to them about that. All right, so once you think you're eligible and you're ready to apply, we do have a site called CPH Central. If you go to our website, in the upper left-hand corner, there's a place that says Get Certified, and then there's a drop-down menu. You basically submit a little bit of information. If you're applying as a student or alumni, there's nothing to upload. You just answer a few questions, and then your school will approve you to be eligible to sit for the exam. And this is just a snapshot of what our website looks like, and you can see Get Certified in the upper left corner. So once you apply, we suggest give your program about 2 weeks to prove your eligibility. If you don't hear back within 2 weeks, feel free just to send us a note and say, hey, can you help me out and try to get my application approved? And we're happy to remind your program administrator to approve your eligibility. So within about 15 minutes of being approved, you will get a message from our testing partner Measure Learning. But again, you do not have to take your exam right away. You can wait as long as you wish. Just hang on to the scheduling instructions, and then you can use them whenever you want to. And this instructions say you can schedule as soon as 72 hours later. Sometimes you can even schedule more quickly, but we suggest you not put yourself in a bind, and do give yourself at least a couple days window to schedule your exam. So the exam is $385. That's the application and exam fee all rolled into one, but we do have a number of discounts in place, and we've actually got more discounts that would fit on this screen, but on our website, you will see a place that says Get Certified and then fees and discounts, and you can take a look there, and hopefully you will qualify for a discount that'll bring the price down to either $315 or $250. So just as I mentioned at the very beginning, we do have 11 schools and programs that require the exam, not the University of Hong Kong, but I just thought it'd be interesting to share these CEPH accredited schools and programs that have made the decision. They integrate the CPH exam requirement into the graduation process, and it is also often part of their CEPH accreditation. They do use the results of the exam towards their CEPH accreditation. So you have lots of peers at other CEPH accredited schools and programs that are getting certified in public health. So let's talk about the exam. So the CPH exam is a 200 multiple choice question exam. So the average, well, we do schedule 4-hour windows. So when you schedule your exam, it will automatically be a 4-hour window. But the average candidate takes about 2.5 hours. So we tend to give you more time than you need. But if you feel like you like to have more time on an exam, so you can take your time and think about your answers, then you should have more than adequate time. Any candidates, however, that do need medical accommodations of more time, there is a process where you can request accommodations and get 1.5 time if you need it. So we test all year long. We do not have testing windows. We literally test every day of the year. So you can test whenever it's convenient for you. So if you have a break coming up, or there's a time of year where you're going to be a little less busy, then you can test then. You don't need to wait on us to give you any kind of testing window. So we test 2 different ways. We have different options. You can choose whichever you wish. It doesn't matter to us how you choose to test. We do have computer-based testing centers. We have 1,400 testing centers around the world. They're typically open Monday through Saturday. They each have their own schedule, but that's pretty typical, is that they're not open on Sundays. I looked for testing centers in Hong Kong, and we have 3 in Kowloon. I don't have the exact addresses, but hopefully these neighborhoods would give you a pretty good sense of where the testing centers are. When you go to schedule, you will actually see the full address of those testing centers. So if these testing centers are not convenient to where you are, or if you just would prefer to take the exam at home or at your office, you can certainly test by live online proctor. So the live online proctor process requires that you have a PC or laptop. You can't test on your phone. You can't test on a tablet. It has to be a computer. You have to have a private room with nobody around, and you have to have a clean environment, meaning not a lot of clutter. You do need to clear off your desk, and a high-speed internet connection. But it's actually a really nice way to test at your own convenience. The computer-based testing center, you get to pick from 4-hour windows. The live online proctor, you can test 24 hours a day, and you can pick your testing window. So it does offer a little bit more convenience. But if you're worried about something to go wrong with technology, you're worried about your internet connection, then you might want to consider the computer-based testing center. And by the way, if you end up retaking the exam or you have to reschedule, you can switch how you test each time. It's every session you can make that decision. So just pick the one that sounds like it would work best for you. And then if it doesn't work, you can always switch the next time to another method. So when you take the exam, we have instant scoring. So you don't have to wait to find out how you did. You will know right then if you passed the exam or not. And then by the next day, we will send you a message congratulating you on your success on the exam. And then you can actually download your full score report and find out how you did by each domain through logging back in through our portal. So your scores are available to yourself the day after you take the exam. But if you're taking the exam as a student or alumni, I just want you to know that your program administrators at the University of Hong Kong will be able to see your scores. And part of the reason for this is that the schools and programs, even if they're not requiring the CPH exam, they find it very helpful to see how their students are doing on the exam. They have the ability to run comparative aggregate reports where they can see how all CEPH accredited schools and programs are doing by domain and comparing it to how your program is doing by domain. And it's just really helpful because they can see where they're underperforming and overperforming by domain. But they can, a select number of people at University of Hong Kong will be able to see your reports and your score results. So we do know that folks worry, how hard is the exam? Am I going to be able to pass? Well, I'm sure you all will do great, but I thought I'd share this slide with you that shows that our average pass rate is actually, the average is over 85%. And currently the pass rate is 88%, which is great. So that means obviously 88% of candidates do end up passing the exam. You can see on the slide, we've got a couple times in the past where we've dipped, and I just want to address that. It's not that the exam became more difficult. Those were times when we were piloting a new type of eligibility to find out if we should open up our eligibility. We started off only testing alumni, and over the years we've added different types of eligibility, and this is pretty typical when you do a pilot. Is that you open it up a little more broadly than you would think, and then based on those results, you make a decision. So that's where the dips come in. But overall, if you average all this out, our average pass rate is about 85%. So I also wanted to show you some statistics. I ran this the other day just because the NBPHE is based in the United States. We try very hard not to make the exam too US centric is the term that we use. There are a few questions on the exam that are US centric, and the reason why is because most candidates at the present time are testing in the United States. And for that reason, employers in the United States are typically hiring those CPHs. And so they have certain expectations what candidates should need to know. But we go through every year and we really scrub our exam and take out anything we don't think is absolutely essential on those few questions that are US centric. So most of the questions are not specific to the United States. Most of them are very broad and would apply anywhere in the world. That said, we do also keep an eye on the statistics. How do candidates do from the United States and outside of the United States? Because we want to be conscientious about it and make sure that we're not testing our exam is not too biased for US candidates. And what you can see here is there's a 1% difference that US candidates do 1% better, both on the exam for students and for alumni. So I hope this will make you feel a little better that US students really don't have any particular advantage. It's a 1 point difference on the exam. And if you have more questions about that, we can talk about that at the end during the Q&A. Oh, sorry, going the wrong way. All right, so once you pass the exam, so we will post your information, just your first name and last name and your CPH number on a registry that's publicly available on our website. You can go to it now. It's on a tab called Search for a CPH, but we only post candidates who have passed and are active. So if you didn't pass, don't worry. Nobody publicly will ever know. And if you lapse your CPH, if for some reason you don't stay certified through recertification, then you won't show up here as well. So it's only the active CPH show up on this registry. And employers typically use it to verify eligibility of candidates when they're getting ready to hire them. We will mail you a hard copy certificate that you can get framed and hang in your office if you wish. That'll usually go out within a couple weeks after passing your exam. And you're fully certified. And we'll also send you a link to a virtual CPH certificate. These are really helpful. I don't know about you all, but a lot of us don't go into our office anymore or very frequently. So that certificate that we hang in the wall doesn't get seen by a whole lot of people. The virtual certificate is a customized URL that you can post anywhere. So if somebody clicks on it, it'll show them your certificate. And if they scroll down, they can learn more about the CPH. So you can put that on your LinkedIn profile and after your email signature. And it's just a really nice way to share that you are CPH certified. So if you do not pass the CPH exam on the first try, it's okay. You can take the exam again. Most candidates do better in terms of scoring when they retake the exam. So we do encourage you to, reflect which domains you didn't do as well on, and then you can take the exam again. The price drops to $150 for every attempt. There's no verification process. You basically log back into our website, pay the $150 fee, and then you get another set of scheduling instructions. So let's talk about what's on the exam. Okay. So we talk about our content outline. That is a map of everything that is on our exam. That's kind of certification speak for the topics that we cover. So we have 10 domains. I'm going to show you in more detail in just a moment. But I want to just mention how we come up with these topics. How do we decide what's going to be on the CPH exam? So we use a process called a job task analysis. And the job task analysis is what just about every certification body uses to determine the content of their exam. It's basically a detailed survey that is given to members of a profession, people working in public health in our case, and we ask them about the tasks that they do. We need to know, what are they currently doing in public health, how important is it, and how often do they complete these tasks? So we put all the results together, and then we go through a process where we make decisions about, there might be some tasks that we were thinking about that just aren't commonly done or aren't terribly important. The core of the exam should be the most common and the most important functions that happen in public health. And then that is how we put together our CPH content outline. And what you can see here are the domains of our exam. So think of the domains like chapters in a book. Within each chapter, we've got the actual content. This is how we organize the content of our exam. So I'm just going to sit here for a moment. For the sake of time, I'm not going to read through all these, but hopefully these more or less reflect the things that you are learning in your program. They might have slightly different names. They might be organized. You might have more integrated courses, but I would hope that you would be picking up most of this information through your coursework throughout your degree program. Okay, so some of those domains, however, you may be less comfortable with. Perhaps you're focusing on one area and you only are going to take one class on one of our domains. You're not quite as comfortable. The good news is that we set our passing score overall, so you do not need to pass every domain. So you only need to pass overall. What that means is that, yes, you can have some domains where you're a little less comfortable than others. You can not do as well in some domains as long as you do well enough in the others. It's the overall score that determines whether you pass or fail. So don't let a weak domain or two worry you too much. So I'm going to do something, and I should have set this up as a poll, but I was worried it wasn't going to work. So we're just going to do this manually. I thought it would be useful just to share a couple of practice questions with you so you get a better idea of what does our exam look like? And please understand, these are not real questions. We would not share the questions with you and then include them on the exam. And they also will not cover the gamut of the content of the exam. I just pulled 4 out randomly. So I'm going to share them with you, but it should kind of give you, I think, an intuitive sense of what to expect when you take the exam. So I'm going to take a moment and just let you read through these, and then I'm going to show you the answer and see how you could tell yourself how you feel about the level of our exam and our content. Okay, so I'm going to go kind of fast here. These slides are going to be shared with you if you want to look at these later. They are in our practice exams that I'll show you in a moment. But the answer to this one is drug-resistant tuberculosis cases. I'm going to skip this one because this would take a while to read, but you can check it out in our slides. And the answer is use the Delphi method. I hope you all are feeling comfortable and maybe even getting the answers right. And one last question we're going to look at. Okay, ready for the answer? All right, so again, that was just a snippet, but it should give you an idea of what it'll feel like to take the exam. So those are, I think, pretty good examples of the type of questions that we have. So let's talk for a bit about study resources, things that you can do to prepare to take the exam. So if you go to our website, again, get certified, there is a page called Study Resources, and I suggest you check that out. We've actually got a video on that page that is going to give you similar advice that I'm about to give you. So we suggest you first start by looking at the content outline. So this is a page from the content outline. It's 10 pages, 10 domains, and lists out the tasks for each domain. So we ask the folks who help us write the exam questions, they have to make sure that the questions relate to one of these tasks. So this just gives you a visual of what the content outline looks at. So I suggest you just scan it. I wouldn't study it too carefully. I would just scan the domains and the tasks. And as you go through the domains, I think you'll have a pretty good sense of this domain I'm familiar with. I have a job in this area. This is what I'm focusing on in my program. Then you might get to some domains where you think, I don't know much about this. That might be where you need to study and pick up some new knowledge. But I would scan this the first time that you look at it just to get a very high level sense of where you are for each domain. Then we do publish some actual sample questions similar to what I just did a moment ago. And it's just to give you an idea of what do the questions look like? How are they written? How complex are they? There's only 10 sample questions, so it's just a quick scan, just like a little sneak peek. So we do have 2 practice exams. I think these are your next stop, is I would take at least one of the practice exams. It'll give you an assessment of how you're doing by domain. So what it does is it'll give you your score. It'll categorize each domain. And if you have, I'd say, more than a few areas that are considered possible weaknesses, that means you might want to study a little bit more. But if you have some that are saying that you did adequately satisfactory, which is just fine, that's good enough, or even areas of strength, then that's great. But if you have quite a few domains where your assessment says you have areas of weakness, that means that you probably need to study a bit more before you take the exam. So we have 2 practice exams. They're free. You can take them anytime you want. You can take them multiple times if you wish. There are 50 questions each. And remember, our exam itself is 200 questions. So I suggest that you give yourself no more than an hour to take the practice exam, because that'll also give you a better sense of the pace at which you need to answer questions in the actual exam. So once you figure out where you might need to study a bit more, then we do have some free resources available. So ASPPH a couple of years ago recorded webinars on each of the domains. They're free, live on demand, or they're recorded on demand. So you can certainly watch these webinars. We get really good comments about the webinars. So please use these as a resource if you have time to review them. ASPPH has a study guide that's online only. It's just lots and lots of practice questions. So if you're just worried about taking a standardized exam, this is a good study guide because it'll give you lots of practice in answering standardized questions about public health. The American Public Health Association with the University of South Florida put together a study guide that's sort of chapter based. So it goes through each of the domains and explains a bit more about each of the domains, and also has some sample questions. So this is a great resource if you feel like you need to learn a bit more about some of the domains. And then there is a third study guide published by Springer Publishing. It's lots and lots of study exam questions. So again, if you need more practice, this is another resource for you. And then finally, ad hoc, we do host review courses. We just had one at APHA in November. We're planning one with the Nursing Association this spring. We might have one this summer. Not sure if it'll just on our own. We're not sure if it'll be virtual or in person, but I suggest you keep an eye on our website in case there is an opportunity for you to participate in a review course if you're interested. Typically, we bring in a number of professionals and faculty, and then they go through, like I said, the basics of a number of the domains just to help prepare candidates to take the exam. So the last point I want to make, though, is your degree program is really important as preparation to take the exam. I'm sure that the things that you are learning right now are very germane to being able to pass the exam. So one suggestion that we hear from candidates is go back and review your intro level textbooks if they're related to the domains. So you're right now learning a lot of the things that you need to know. So students tend to do well on the exam. You remember how to take exams, you remember how to study, you're currently doing it now, and all the information's fresh in your mind. So, so just consider your education as an incredibly important part of preparing to take the exam. So I'm going to touch on the recertification process, and then I'm going to open it up to questions. So after you are certified in public health, you do need to stay certified in public health. So our process is a little different than other certification bodies. So we require CPHs to report 50 recertification credits every 2 years. We do have an online portal where you can pay the $95 fee and report your credits. So it's very easy to maintain your certification. So we're different in two ways, though, is we built our recertification specifically to reflect the needs of the public health community. First, we don't require CPHs to go to conferences, to go to specific events. We open it up to any type of activity that's really professional development or continuing education. So we give opportunities to earn credits for lots and lots of different types of things. You don't need to pay providers to earn credits. There's many ways you can earn credits that are free. And are online. Examples are we give credit for volunteer leadership service. This is something that is really important in public health, as that folks are doing things outside their job for service activities. If you present or you do public speaking or you're publishing articles, you can get credit for those sort of things too. So we do have more options than most certification programs to maintain your certification. And the other is we do not have pre-approved providers. So we say that as long as the content is related to public health and meets our guidelines, then it will count. You do not need to go through a provider and ask their permission to report this to us. So we really try to build this flexibility in to meet the needs of the public health community. So we do have a portal. You go back into your CPH Central where you applied in the first place and you report your credits. It keeps track of where you are. If you're ever short credits, we do have a couple of databases where you can find credits. These typically have online modules, online webinars, etc., where you can earn additional credits if you need some additional ideas. And finally, after you're certified, we hope that you'll tell the world that you're certified. We hope you'll use that URL with your virtual certificate. We do have a site with Cafe Press where you can buy merch just to show off a little bit and share with your colleagues that you've got your CPH. We really try hard to build a community with those who are certified in public health. One way we do this is we have a very active book club. I think we have 1,300 members in it right now. And every 6 weeks or so, we read a public health book, and then one of the CPHs lead the discussion. Right now, we're reading Dope Sick about the opioid crisis. So as soon as you're certified, you'd be invited to join our book club. And certainly we have a LinkedIn group as well that's active. Got lots and lots of our CPHs communicate through a LinkedIn group. They share jobs or what's happening in public health. And then we post announcements there as well. So you'd be invited to join that LinkedIn group. All right, so I got through everything in just under 45 minutes. So now I'm going to stop and see if you all have any questions. All right.
Thanks, Allison. I'm going to help read the Q&A. So for students that are attending now, if you have any questions for Allison or Chantal, please use the Q&A function and I'll read out your questions so then they can answer so everyone know what the same question is. So I have 2 questions for Allison. And if anyone has further questions, please just type in the Q&A chat. Okay, Allison, so I have an alumni, Kevin, who has asked 2 questions, but I think one of them you have already answered for us. So the first question was asked if there's any past papers for revision or preparation. So Allison has already given you the resources. The second question I think Kevin wants to know is the passing score, how many points to get to pass the exam. So if it's out of 200 questions, I think he wants to know what's the passing score.
That's a great question. So we don't share the actual passing score because at any given time, we've got, I think right now we have 4 different versions of the exam being administered. And because they're unique questions, we have to do what's called equating to set a different passing score for each of the forms. And so it would be really confusing if we shared a passing score, but the passing score on a different form was different. So our policy has been not to share the passing score, but we realize that it makes it a little, frustrating if you're trying to figure out, am I close? Am I close? And that's why my suggestion is first take the practice exams. If you've got, a number of domains, I'd say 3 or more, where you have possible weaknesses is your assessment, then I'm not saying you wouldn't pass, but I'm saying you probably need to study more. But our board also realizes that it would be good to have some statistics to give to folks. So we're actually looking at publishing scaled scores, which will be very, very helpful once we're able to do that. So we're going to be making that decision in the spring. And I think at that time, we would be able to give you a little better idea after you take the practice exam, if you would have passed or not. So for now, we just suggest you look at the assessments that are in the practice exam, and that should give you a better idea of how well you would be doing on the exam.
Thank you, Allison. So Kevin, I hope that answered your question and everyone else who are wondering about the passing score. So I have another question, the second question from an anonymous attendee about the professional title. Is it that they can put as in CPH without, so obviously they graduated with NPH, so could they also quote as a CPH as a certification title on their CV or their LinkedIn page?
Absolutely. So it would be listed the same as you would list a degree. It would be basically letters after your name, and in your education section of your CV or resume, you would list that you are certified in public health. And so when you are certified, we include this in the letter just to remind people, the letter that you will receive from us, to remind people how to refer to themselves. So again, you would list CPH after your degree.
So the next question is about recognition from other organizations, and they actually quoted one of the organizations in Hong Kong. So I think that's just a very specific organization, but I think the overall question is like, are there any organizations that is recognizing certification, or is it more like this is a certification degree, so I have this certification?
Yeah, I mean, I don't, so we get that question a lot, and I can't speak on behalf of individual organizations unless I happen to know, and typically I don't. There's so many employers and organizations in public health around the world. But my sense is if you don't know, if they recognize the CPH specifically, most likely they understand what a certification is. So certifications are all very similar. They have the same standards. They measure the same thing no matter what the certification is. I mean, there's certifications in IT and lots in health and many, many, many different fields and teaching. So most employers do understand what a certification is. So if you say, I'm certified in public health, even if they don't know our exam, they should understand what that means.
Yeah, so I think I got some similar questions also. And I think I just want to add on to Allison's point that, getting a certification is kind of like having an extra a professional degree or professional certification that says that I have passed a certain exam, and then employers can also find out more information about that specific certification on various websites or. Okay, so next question is from Stephen. I just want to clarify something. Yes, so our NPH accreditation year, the CEPH accredited year is 2020. So all our alumni graduates that have graduated past 2020. So if your graduation degree is in 2020, then they are part of the CEPH accredited. So Stephen is one of our alumni that just hits the right before. So he graduated in 2019. So I think his question is maybe on behalf of other alumni. So what if they haven't graduated within our HKU NPH accreditation, and he wants to use what you've mentioned before, using public health work experience to supplement or to replace the alumni from a CEPH accredited school? Could you tell us a little bit more about using that?
Yes, absolutely. And I apologize. I didn't realize there'd be alumni honor. I would have talked about the public health work experience. So our work experience criteria would apply as long as, in your case, if you have a graduate level degree that's not CEPH accredited, and you have at least 3 years of experience in working in public health, then you'd be eligible. So we also have a category for folks who only have a bachelor's degree. They have to have 5 years work experience. But in your case, if you have a degree from the University of Hong Kong public health program, you need to have 3 years of work experience. And since it's 2023 and you graduate in 2019, it sounds like you'd be eligible to take the exam. And I also want to mention, if anybody applies for the exam and it turns out they're not eligible, we will fully refund their fees, because we know, we don't want folks to hesitate applying because they're not sure they're eligible. So we will refund your fees if you are not approved as eligible.
Thank you. So I also have a similar question from Brian. I think he's just echoing that he's also an alumni using public health experience instead. I think maybe so I guess the student, if they want to be eligible, they would have to give the CPH description of their public health experience, maybe in a description of what their work experience is, what they've been doing in the past, in order to be eligible for 3 years public health experience. Is that right?
That's right. Yeah. And our application, if you apply under work experience, it'll prompt you to upload a copy of a transcript. It can be a student copy, it's fine. And you'd also upload your resume or CV, and then we ask you a few additional questions. But you basically would tell us what your work experience is so that we could approve your application.
Thank you. So I have a question from Tom, which Allison, I think she has mentioned, but maybe I'll just verify the right answer. She wants to know that if the certification is going to last for 2 years, that they will have to renew it every 2 years.
Yep, that's right. Every 2 years, you need to apply for recertification. We do have extensions if folks get busy and just haven't earned enough, then they can always extend, but it averages out to every 2 years you need to reapply for recertification.
And so I have another question from Anonymous about what are some potential prospects for the CPH title?
I'm not sure if I understand the question.
I think they mean career prospects. I believe that's what they mean, career prospects. Yeah, maybe whoever is the type, maybe can write in Q&A just to clarify questions, not potential. I'm guessing career prospect, but I'm not sure what they mean.
Yeah.
So if you type that question, if you could just retype or clarify what you mean in the Q&A, so then we can help you answer that question. Okay. Our next question is, do you need to complete the NPH program first before applying for the CPH examination?
So we would say no. Most schools and programs allow their students to take the exam after they've taken either 1 year of courses or the core. It's determined by the school or program. There are a few that want the students to wait until the end of their program, but it's completely up to the university when the students can take the exam. So it would really be up to University of Hong Kong to make that decision. But from our perspective, yes, they can take it while they're a student. And if they pass while they're a student, they will be CPH provisional. They can use that after their last name, but they have to add the word provisional. And then once they graduate, they will be fully active CPH.
And I guess I can answer on Bahama University. We do recommend students to complete the whole MPH program first before applying for CPH examination. This is purely because, especially your full-time student, you're basically taking courses until the very last month of your graduation. So why not just take the time to reflect on what you have learned and to really think about your capstone and your practicum and all the skills that you just learned. There's really no rush for you to rush in. So our recommendation would also to echo at Allison to complete your MPH program first, then do the CPH examination. Okay. So I have a question. If I got my certification, but then they didn't renew it, would you need to redo the test?
As long as you, we have a process where you can apply to reinstate is what we call it. And as long as you do that within 5 years, then you just have to report makeup credits. You have to be lapsed inactive for a very long time before you'd have to retake the exam. You could always choose to retake the exam if you want to, but so far we haven't had anybody want that option. They all just report makeup credits if they miss the deadline and lapse.
Yep. So I think they might have missed your slide when you mentioned it. They're asking what's the fee for recertification?
Yeah, it's $95 every 2 years.
So if anyone has any questions about the fee payment or recertification, remember to visit the CPH website. They have a very clear layout about what's the fee for first examination, what is the fee for recertification. So remember, check out the website. Okay. So Anonymous asked if they are going to sit for the CPH and they wait. Okay, so I think we just answered that question. So Allison has answered that if you need within 5 years of your certification, make sure you get your certification and you can maybe just, you have that lapse time of buffer system. So we've just answered that question. Next question. How many times would you recommend to prepare the examination?
That's a great question. Actually, Chantal's running a survey so that we can give you some evidence-based answers about the preparation time. So I had some colleagues that took the exam a few years ago, and I like to give this example, is they met as a group and they reviewed the domains, one domain every 2 weeks. So that might be one approach to spread it out over the course of several months if you're meeting in groups. I think typically people take probably less than 6 months if they're studying. There are people that decide, oh, I need to go back and take a class, so it might take much longer. We rarely see people decide to get certified and then sit right away. Almost everybody spends at least a few weeks, and I think a few months is more typical. But once Chantal has finished our survey, we'll have a better answer for you. But again, you're in class right now. You're taking classes. You are essentially studying for the exam. So just consider that is that you're acquiring the knowledge you need to pass the exam right now through your classes. So I think I can see the next question. I think they're asking, what can you do with the CPH? And so it's really an enhancement to your credentials. You're earning your degree so that you can go out and get a job, and then employers will understand what you know. The CPH complements that. So for this, it's probably getting your CPH, the same motivations would apply. Why are you getting your degree and how are you going to use your degree? Think of the CPH as a complement to your degree. It really adds on to your credentials, and then employers will know that you have both. And again, they measure very different things, but they work together very nicely. So I would think it as a complement to your degree.
Thank you. So I think I cleared out most of the questions. There was one question that I just want to clarify. I think someone asked about the currency of the dollar. So obviously the currency is US dollars. So
thank you. I should have thought of that when I did the slides. US.
US dollars. Yeah. So not how much. Yeah. So yeah. Oh, okay. Yeah. So we have a question about the difference between CPH certifications over the MCHES certification.
Sure. So they're built in very different ways. We use very same models to administer our certifications. So there's a lot of similarity to the process. The difference is that CHES and MCHES, we would consider them more specialized certifications because they focus on health education. We focus on the entire breadth of public health. And so, you know, it really depends, I think, on what your area of focus is. Our advice is if you think you're going to work in health education, that's your thing, you don't see going into other career tracks, then I would say, yes, get your CHES and MCHES. You can always get both. A lot of people do. But absolutely, if you think you're a health educator, then I would think about getting CHES or MCHES. But if you're interested in other areas of public health, if you know, if you think you might gravitate to other areas outside of health education, the CPH is more applicable because we test on all areas of public health, not just health education. But again, you can always get both.
I think we're doing pretty good on time. Our seminar was last year for an hour. We will stay maybe for one or two couple of minutes in case anyone has any further questions. But I do want to take the time now to thank both Allison and Chantal for spending their morning with us and joining us in our evening to share and to tell us a little bit more about the CPH examination for our students and alumni. Thank you both very much for your time.
Thank you for
Thank you
having
so
us.
much for having us. Yes.
Okay. So I don't see any other questions that popped up in the Q&A. Again, we encourage you, they have a very resourceful website. So if you have any further questions about the CPH examination or the process or logistics, please visit their website. But we hope that this was a very well-informed session for everyone and they can learn more about the certification exam. Yeah, so I don't see other further questions. So I think we are pretty good on time. We're going to end the webinar session now then. Okay. Thank you, everyone. Thank you again to Allison and Chantal, and have a great weekend, everyone, ahead. All right. Bye, everyone.
Bye-bye.
Bye.
Bye-bye.